Imagine a safety net that was supposed to catch you, a financial safety net designed to protect your health. But today, 9 out of 10 of its ropes have snapped. This isn't a theory, this is the stark, ugly reality of the Medicare Part D prescription drug coverage market. And yes, by any measurable standard, the only word for what is happening is a collapse. I'm not saying this to scare you. I'm saying this because you need to know the playing field has changed and the old rules no longer apply. When Medicare Part D went into full effect back in 2007, 50 different insurance companies were eager to compete for your business, offering multiple plans, diverse options, and real choices. Jump forward 18 years due to pharmaceutical costs, government policy shifts, and the simple need for companies to stay profitable, that number has utterly cratered. In 2024, the available pool was already down to just 11 national carriers. Then came the full force of the Inflation Reduction Act in 2025, and the carriers ran for the hills, leaving only 7 major national companies offering coverage. Now for 2026, we are looking at just 5 national insurance titans left standing. Think about that for a moment. If you use the stock market as your reference, a quick 10% drop is called a crash. A prolonged decline of 20% is called a depression. We have seen a 90% decrease in the number of carriers willing to offer you a plan. We have seen a 90% decrease in the overall options available for you to choose from. Even in the last 12 months, from 2025 to 2026, there is a 1-year, lightning-fast 31% decrease in the total number of plans offered. The Part D market is not gone, but it is holding on by a handful of threads controlled by a small group of companies. This is an oligopoly, pure and simple. And the consequences for you, the Medicare beneficiary who relies on this coverage, are immediate, personal, and financial. Let's start with the one piece of good news, the undeniable financial life raft that comes with a critical asterisk. For 2026, your maximum out-of-pocket cost for medications is capped at $2,700. This is a spectacular, life-changing change for those Americans on complex, high-cost medications. It stops the kind of financial ruin that can come from needing life-saving specialty drugs. This cap is a tremendous relief, but that relief comes at a cost, and it's a cost that many people forget to calculate. Your monthly premiums, just to have the Part D plan, do not count towards that $2,100 maximum out-of-pocket number. They are an extra fixed cost, and those costs are exploding. The government regulates how much an insurer is allowed to increase your premium from one year to the next. For the 2026 plan year, that maximum allowed increase was $50 per month. Not $50 total, but $50 more than what you were already paying. And let me tell you, multiple plans are hitting that $50 per month increase threshold, an extra $600 a year just to keep the status quo. Others are seeing $30 or $40 spikes. Here is the shocking new reality. If your Part D drug plan in 2026 is $45 a month or less, you are officially on what is considered a low-cost plan. This is how quickly the market has shifted. And the range, I picked a random zip code in California just to check the data. The lowest cost plans were $0, $5.50 and $6.20. So far, so good. But then the next plan jumped to $70.60, the one after that was $103.60, and the most expensive option on the list climbed all the way to $172.90 per person per month. That's over $2,000 a year just in premiums before you buy a single pill. You must internalize this. This premium cost is only part of the equation. A low monthly cost is tempting, but it can lead you directly into a far more expensive trap. Because the premium you pay leads directly to the second way this collapse impacts you, and that is through the drug formularies. A formulary is simply the list of approved medications your specific plan has agreed to cover. Insurance companies are not required to cover every possible brand or class of medication. They have pharmacy and therapeutics committees that decide what goes on the list based on clinical efficacy and, yes, the cost to you and the company. Here is the high-stakes truth that $12,100 maximum out-of-pocket number only applies to medications that are on your plan's formulary. If you are taking a medication that is not on your plan's list, you are responsible for 100% of the cost. And that money does not help you reach your maximum cap. This is the gamble. In general, and this is the universal trade-off, the lower monthly cost drug plans, those $0 or $10 deals, have significantly tighter, more restrictive formularies. They are great if you take no medications or only cheap generics. But once you start needing the big dogs of high-cost specialty medications, the formularies get much more flexible in the higher monthly cost plans. But even if your medication is on the formulary, you are not out of the woods yet. That formulary list is further organized into tiers, spelled TIERS. Most plans have 5 tiers, from Tier 1, preferred generics, up to Tier 5, specialty medications. As you move up the tiers, both the cost of the drugs and your financial responsibility increase, and this leads to a massive, quiet shift that will shock many people in 2026. A lot of drug plans are rapidly moving away from a set copay, like paying a fixed $5 or $10 for a generic, to a percentage-based coinsurance for all or most tiers. Instead of $45 for a Tier 3 drug, you might now pay 20% of the drug's total cost. If that drug costs $500, you are now paying $100. This is a hidden premium increase that hits only when you fill the prescription. You need to check your annual notice of change, your ANOCI letter, immediately. You need to see if your critical medications were moved to a higher, more expensive tier, or if the coverage arrangement silently moved from a predictable copay to a risky percentage coinsurance. Because right before your insurance even kicks in, there is a fourth financial hurdle that is also getting bigger. Deductibles are a very real, very high barrier, and they are escalating. The government sets the maximum allowed deductible, and for 2026, it has risen from $590 to $615. The deductible is the dollar amount you must pay out of your own pocket first before the insurance company even begins to lend a hand. Let's visualize this. Imagine your total drug costs in January are $1,000. You already paid your monthly premium, which is an extra fee. Now, you also pay the first $615 of that $1,000 bill entirely yourself. Only the remaining $385 is split up with your copay or coinsurance amount. You still pay a portion of that $385, and the insurance company covers the rest. We go back to that random California zip code data, the picture becomes clear. 9 out of the 12 plans available had the full $615 maximum deductible. You have to be prepared to pay that upfront cost. Why? Because the only way to avoid that high deductible is to pay a massive premium. For example, one plan with a $0 deductible had a crushing monthly premium of $172.90. The choice is a high fixed monthly cost or a high variable annual cost. And for many, you are now facing both higher premiums and a higher deductible. For those of you with significant drug costs who have been coasting along in the latter part of this year with low out-of-pocket expenses, you must remember this truth. Your deductible and your maximum out-of-pocket limits reset on January the 1st. January is the toughest month of the year for people relying on Part D. You are starting fresh with that full $615 bill. You must budget for this. All of these compounding complexities, the premium hikes, the formulary restrictions, the shift to coinsurance, and the rising deductibles create an urgent need for professional, unbiased help. Which leads us to the fifth and perhaps most insidious impact of this Part D collapse, the death of the free agent and broker help. This is a winding, ugly thread, but you need to understand it, especially if you rely on an agent. Back in 2024, insurance companies started cutting agent commissions for Part D plans. In 2025, the vast majority followed suit. For 2026, commissions for standalone Part D plans are nearly extinct. And this is not just an agent problem, it is entirely your problem. Here's the legal trap. If an agent or broker accepts any commission from any insurance company for any Medicare help, say an Advantage plan or a supplement plan, that agent is legally prohibited from charging you a fee for any other Medicare help. They cannot charge you to review your Part D plan, even though they are no longer paid for it. If you try to compensate them out of the goodness of your heart, they must legally decline. The gesture is sweet, but the rule is ironclad, and this rule has caused a massive fissure in the market for advice. I cannot speak for every single agent, but most of them have now been forced into one of three camps. First, you have the agents who are simply saying, "No Part D reviews, period." They are unwilling to take on the time, the risk, and the complexity of helping you for zero compensation. Second, you have the agents who will only help existing clients, the clients who already pay them a commission for their supplement or Advantage plan. If you are not in their book of business, they will kindly refuse to take you on for Part D help. The unspoken message is no commission, no help. Third, the same applies if you are new to Medicare. Many agents will only help you with the crucial Part D review if you agree to let them handle your other commissionable plan, like your supplement. The key takeaway is that the incentive structure has vanished. The financial motivation for an agent to spend the 40-60 minutes it takes to accurately review your medications and find your optimal Part D plan is gone. And a sharp word of warning to you, you may encounter a special, illegal subset of agents who are trying to work around this rule. They try to creatively charge you a fee for drug plan consulting by spinning up a separate company that is not commissionable. This is illegal activity under Medicare rules. Some don't know it, but others absolutely do not care. If you are asked to pay a fee to an agent for Part D help, you need to walk away immediately. So if your trusted agent can no longer afford to help you, or is unwilling to take on the zero compensation work, where can you turn for unbiased, necessary advice? You are not out of options. First, you have the flat-fee Medicare consultants. These are not agents. They are not certified with any insurance company and cannot enroll you in a plan, but because they receive zero commissions, they can charge you a fee for their time and their advice. They can advise you on which plan to choose, offering pure, unconflicted analysis. Second, there are the SHIP volunteers in every state. These are wonderful, compassionate individuals who donate their time to help seniors with their Medicare decisions. But the choice between these options comes with pros and cons, and I have a crucial, more direct option that cuts through all the complexity and is the most empowering solution for you. Before we get to that, let's talk about a familiar name, GoodRx. You may see offers for programs like GoodRx, offering a lower cost than your plan. Where does this truly benefit you? It is beneficial only in very specific, limited cases. A GoodRx card is useful if you are a light medication user and you know you are not going to hit your deductible or your max out-of-pocket cap for the year anyway. Or if you need a medication that is completely off formulary for your plan. In these cases, you might save a few dollars. But here is why using GoodRx on a large scale is dangerous for a senior with significant drug costs. First, any money you spend using GoodRx does not count towards your drug plan's deductible. Second, that spending does not count towards your $12,100 maximum out-of-pocket limit. It is as if you bought it off a shelf with cash. Third, And perhaps most critically, good RX coverage does not count as creditable drug coverage. This means if you rely on it instead of a Part D plan when you are eligible, you could be setting yourself up for Part D late enrollment penalties down the road. For seniors with high-cost medications, good RX is rarely a solution. It is a temporary band-aid that can sabotage your overall financial protection. The reality is this: since you cannot rely on the old guard of agents for Part D help, and since the penalties for choosing the wrong plan have never been higher, your most powerful, most cost-effective path is to take control. I am not licensed or able to help every single person one-on-one with their Part D review, but what I can do is empower you to become your own expert. I make a tutorial video every single year that shows you exactly how to navigate the official Medicare.gov government website and use their prescription drug plan tool. This tool, using your specific medications and your preferred pharmacy, will calculate which plan has the lowest overall cost for you, not just the lowest premium, but the lowest total annual cost, factoring in all of the deductibles, co-pays, and co-insurance. I release this video every October 15th because that is the day the government activates the sign-up button, and I want you to see the process live. If you're watching this before October 15th, subscribe right now to be notified. If you're watching it on or after, the video is already here on the channel, ready to be watched. All right, let's wrap this up with the final verdict and the takeaway you need to internalize. I still believe with every piece of evidence that this is a collapse in how the Part D program is being delivered. The bad news is we have an oligopoly. Only a handful of companies are offering the viable options. But here is the critical piece of analysis. This is not an oligopoly of evil titans controlling the means of production to make a massive profit. There is not a ton of profit in Part D plans themselves. This collapse is happening because the regulations and the cost to do business in the Part D sphere continue to go up, and more of that risk has been violently shifted onto the insurance companies. This regulatory pressure leaves them with severe, unsustainable losses, forcing 90% of them to wash their hands of the market entirely. This entire mess, the collapsing options, the rising premiums, the hidden co-insurance, the vanishing agent help, makes everything more complicated, more confusing, and more of a headache for you. The roller coaster shifts in rules, and regulations are happening at breakneck speed. I am not saying I like these realities. I am not supportive of them. I am simply a Medicare nerd, and my job is to show you exactly how it all works so that you are better able to make decisions that are strictly in your best interest. The secret code word for this video is nerd. If you have made it this far, please type nerd in the comments section below to let me know you're ready to take control. If you would like to watch the video on how to find the single lowest cost drug plan available to you, you can find that video linked here. Or if you'd like to watch a video where I go over your different Medicare helper options, agents, SHIP volunteers, or flat fee consultants, and the pros and cons of each, that video is linked here. Thank you for making it this far. Hit the subscribe button to stay ahead of these constant changes, share this video with anyone who uses Part D, and I will see you over in one of those next videos.